So today's my topic is Moka Icecubes, my experience. Here Moka stands from the midazolam, ondansetron, ketamine and atropine. So the background is that in my pediatric practice of since last 30 years, I am doing at least 25% of the pediatric practice in my total practice, and I was not satisfied with my pediatric practice because all children, when I was going to anesthetize, they will come either by crying or the fear of pain or the separation from their parents were very difficult. And even I had an experience with my daughter's experience for the CLW suturing anesthesia, and it was very difficult. Even at the age of 10 years, she was very anxious with fear of injections and not cooperative for the taking anesthesia. So I have decided to find out some remedies which can be easily used and available. Now you know that all children in pediatric practice are suffering from fear of unknown, fear of injection, anxiety, and fear of pain. And difficulties and sequelae in pediatric patients for giving anesthesia is pre-surgery anxiety in children may result in preoperative and postoperative complications, which we want to avoid. And anxiety associated with operative procedure is distressful for the children and family. So this preoperative anxiety displayed in several ways in pediatric patients when confounded. That is, there is difficulty in separating patient from the parents, difficulty accepting the anesthesia mask to assess the intravenous lines, and everybody has experienced these difficulties in their pediatric practice. So my aims and objective were to provide comprehensive and easily available preparation for premedication in pediatric patients undergoing anesthesia. So I have used 4 common drugs, injectable drugs available in EOT. They are also given orally as a syrup in some of the pediatric anesthesiologists. And I have used midazolam, ondansetron, ketamine, and atropine. And I have given the name is Moka Icecubes. I have prepared I have combined this 2 ml of each drug with or without flavor and given orally as an ice cube for pre-medication because all children love chewing ice cubes. Why I have chosen the ice cubes? There is a story. Because in initial practice, when I was combining all these 4 drugs as a solution, and when I was giving as a teaspoonful, then these children were not accepting even that they were experiencing they were feeling that sir is or doctor is giving me some of the injections or some of the solution to give me this. So because of the fear, they were not accepting. And I found that all children are loving ice cubes to chew that part, and so that I have prepared the ice cubes. How do I do it? I have taken permission from my surgical colleagues and hospital authority and explained in details to the parents of the pediatric patient about these ice cubes. I have taken also written informed consent from the parents. In last 5 years, actually in last 10 years, I have completed 1,000 patients. But in last 5 years, I have for pediatric patients from age 2 to 15 years, I have selected from ASA1. And following surgical procedure were selected. It was all daycare procedures, either tonsillectomy, foreign body removal from the nose or ear, circumcision, cystoscopy, congenital hernia repair, cervical lymph node removal. Colonoscopy and upper GI-scopy were the maximum in my this ice cube study because I am doing maximum practice in ENT, Euro, and gastroenterology. And I had also given these ice cubes to non-operating room anesthesia, either in dental and radiological procedure. And some of the investigation are also done with these patients, either complete hemogram with BTCT or fasting blood sugar, chest X-ray when it was required, and other special investigation as per demand and status of the pediatric patient. Here, I have chosen why more than 2 years of my child because separation anxiety is usually not achieved before the age of 1 year. And still for safer side, I am using Moka Icecube in more than 2 years of the pediatric patients. Pediatric patients were given Moka Icecubes according to age by trained OT staff of my operation theater 1 or 2 hour before anesthesia and surgery in pre-operative area, means on this recovery room. And Moka Icecube is prepared with the maximum all 4 drugs from IV ampoules or bulb 2 ml each and putting that liquid in deep fridge to form ice cubes for overnight. And for easy palatability of ice cubes, I have added a sugar or apple juice or coconut water. And my dose of the ice cube where I was giving 1 ice cubes to 2 to 5 year of age child with weight between 8 to 20, 2 ice cube from 5 to 10 years of age child from weighting between 20 to 30, 21 to 30, and 3 ice cube for the 10 to 15 years of child up to 40 kg. And one ice cube contains 2 ml each, 2 milligram midazolam, 4 milligram ondansetron, 100 milligram ketamine, and 1.2 milligram atropine, and 2 ml of apple juice or coconut water. And during this time, trained OT staff were continuously monitoring these pediatric patients with pulse oximeter, and I have instructed them for the watching any nausea, vomiting, or hypoxia. And parents are also strictly instructed to put their child in supine sleeping after oral ice cube premedication till the further instruction given by the OT staff. If you see that oral pharmacological dose from the textbook is from midazolam or ondansetron, ketamine, and atropine is on this way. And my ice cube dose was even midazolam, atropine, midazolam and ketamine was less. Instead of 0.25 to 0.5 milligram midazolam, I was giving 0.15 milligram per kilogram. And for ketamine, 5 to 10 milligram per kilogram, I was giving 5 to 6 milligram per kilogram orally. And the results were very fantastic. 99% kids were sedated well after about 45 minutes to 1 hour, and separation from their parents were possible without any difficulty. So no major side effect or complication found during 1 hour after oral dose, except complaint of giddiness and sleepy state mind. From like they were telling, "Mama, I am getting sleep." Like that was pediatric patients were telling. None of the patients had apnea or required any airway instrumentation. And during that 1 hour, clinically, patients' hemodynamics were stable and SpO2 well maintained with the room air up to 95 to 100 without oxygen. So discussion is here that preoperative period is a stressful event for the majority of the pediatric patients undergoing surgery and anesthesia. And pharmacological and behavior interventions are used to treat preoperative anxiety in children and their parents in so many ways. In order to alleviate physiological and psychological effects of preoperative anxiety in children, most anesthesiologists use either presence of parents or sedative premedication, because separation from parents and induction of anesthesia are considered the most stress-inducing phases. Even I have experienced in so many ways. I was giving injections of ketamine, I was giving oral nasal midazolam, everything, and then still patient was refusing. So I have started this MoCHA Icecube medication in my pediatric practice, considering that part with easy solution. So what were the benefits? Here, the anesthesiologist who allow presence of parents and during induction of anesthesia and oral sedative premedication, they win the situation. And I was finding the fortunate that I was winning that situation. If all 4 drugs are given orally as an individual agent, then none of them alone gives good sedation or favorable condition to separate pediatric patient from their parents. So if you give even alone this ketamine or midazolam, then they will not work. But after combining all 4 drugs and given orally, the absorption is from 16 to 25%, and which is good as a sedative agent. So if you giving 100 milligram ketamine orally as a ice cubes, then the absorption is only 25% maximum. So that is a very good dose for the shadow analgesia. And the side effect of each individual drug is less orally than given by either routes like IV or IM. And sedative effect is good to control pediatric patients. Believe me, they are not under anesthesia, but they are having a very good sedation to separate from their parents. So we can put IV cannulation or face masks in our OT to start anesthesia. If you go to the individual drug, then oral midazolam in dose of 0.5 to 0.75 milligram per kilogram has been used alone for procedural sedation in the literature. Yet dose-dependent respiratory depressions and paradoxical agitation can occur. Here I have used lesser dose of individual drug like midazolam and ketamine owing to their synergistic effect. Oral ondansetron is highly potent and selective serotonin 5-HT receptors antagonist and has favorable safety profile. When administered orally, it is rapidly absorbed by the gastrointestinal tract, achieving peak plasma concentration after 1 to 2 hours, which prevents feeling of nausea and vomiting due to oral and ketamine. So the adding of ondansetron was very beneficial in my ice cubes. And even atropine I have added in these ice cubes. So anticholinergic agent oral atropine is useful adjuvant to ketamine owing to its anti-sialagogue and central sedative effect. The recommended oral dose of anticholinergic atropine is 0.1 to 0.2 milligram per kilogram. Oral ketamine is the main key drug in MoCHA Icecubes due to its shadow analgesia effect as pre-medication. And my conclusion was MoCHA Icecube is novel mixtures of midazolam, ondansetron, ketamine, and atropine. After oral pre-medications, all pediatric patients are calm, cool, quiet, sleepy, and separation from their parents are without any problem. And I do not find any crying, rowdiness, injection fear, or anxiety in both parents and as well as in parents. So I had been the situation in my pediatric anesthesia practice. And believe me, this ice cube was now given in 15 medical colleges across the India as in their pediatric anesthesia department. So things to remember is I have used ice cubes of prefixed doses available in our deep freezer in OT complex. Though ice cubes can be frozen according to individual child's weight as well. You can prepare according to your pediatric patient's weight also. And but here I followed a fixed dose regime and all kids had satisfactory anxiolysis, adequate sedation, easy separation from parents, and face mask acceptance with the no side effect. And this is my paper came in last December 2020 in the Indian Anesthesia Forum about this MoCA Icecube novel mixture for pediatric oral premedications. If I give the some of the usefulness of these ice cubes in another way, that I have also used this combination successfully in 20 pediatric patients undergoing under COVID times, and it is associated with calm and sleepy child. It is often seen that crying childs are associated with more risk of aerosolization and chances of spread of infection, which becomes imperative during this COVID era. So this MoCA scope was very useful in my pediatric practice during COVID time also. I'm also giving these MoCA scopes now in pediatric patients or adult patient as a post-operative pain relief. And believe me, I have started these in adult patients also. Sometimes when the patients are having excruciating pain post-operatively, in spite of giving NSAIDs, in spite of giving any narcotics, then I use MoCA scopes. And there is another way of use is MoCA scopes in palliative care of pain relief in terminal stage cancer, like osteosarcoma story. One of my doctor's friend who has got a osteosarcoma at the age of 18, and he was having a last stage of the cancer and with the lung mets. So at the last 7 days, he was having excruciating pain, and his complaint was like 100 snakes are biting in his body. So they called me, and I had started a MoCA scoops for the post of this palliative care pain relief. And surprisingly, I was getting very good relief in this pain, and patient died very peacefully. So I am now using these MoCA scoops in palliative care patients also. People have started making mocha lollipop ice candy in their practice. So they have gone further to my ice cubes, and they have started a mocha lollipop also. My next plan is to study from mocha to doka. Instead of midazolam, I am adding now dexmedetomidine. And nowadays dexmedetomidine is a very good combination with this ketamine. So my oral dose is 1 microgram per kilogram, and I have more than 25 patients completed, and I am getting very good results. So mocha to doka, my next plan. So I will give advice in this era. Pediatric patient wants more mocha ice cubes. So let's have option in your practice. And these pediatric patients, thanks, because always they are telling always take care of our anxiety and fear before giving anesthesia. And this is my the novel premedication. And I had been the situation in my pediatric anesthesia practice. Thank you.